prescription for a healthier you. It's something many people, especially women, experience in their lifetime, yet many are reluctant to talk about it or seek treatment. That's why GBMC wants you to know that they do have treatment for pelvic floor disorders.
So pelvic floor disorders are conditions that women primarily have that involve disorders of the support of the pelvic organs.
Dr. Joan Bloomquist is the chair of the Department of Gynecology at GBMC Healthcare.
The two most common things that we see are pelvic organ prolapse, which is when there's loss of support of the pelvic organs, including the bladder, the uterus, or the rectum, so that these organs sort of bulge down in the vagina. And then the second is urinary incontinence, which is leakage of urine.
The symptoms of both can vary.
So for pelvic organ prolapse, some women feel like discomfort or a bulge. Sometimes people will say they feel like a tampon is stuck in there or things are actually coming outside. Sometimes it can make it difficult to empty the bladder or empty the bowels if those organs are prolapsing down. For incontinence, it's mostly leakage of urine. Some women have more what we call stress incontinence, which is leakage when they do something physical like cough or sneeze or jump, whereas other women have more urgency incontinence, which is more I've got the urge to go and I can't get to the bathroom in time.
Dr. Bloomquist says the most recent statistics point to nearly a third of women experiencing some sort of pelvic floor disorder at some point in their lifetimes. Many of the disorders are more common as people get older and common in women who gave birth vaginally. That means a large portion of the population could be affected, yet many don't want to talk to their doctors about it.
Sometimes people are embarrassed by this. Talking about leakage of urine or stool or things in that area is sometimes embarrassing for people to talk about. And the other is just that, we're busy being moms and taking care of our families, and sometimes we don't take the time to take care of ourselves. Because they are common, some people think, oh, this is just expected, I just have to live with this. Or they think it's sort of a normal part of aging and sort of, an expectation that this is just what's going to happen. I think the other barrier is that some people think the only treatment is surgery, and they don't really want surgery or they're afraid about surgery, and so they might not come in to see if there are other treatment options available.
But there are several.
The one treatment that's available for any of these disorders, which would be our most conservative, is to do some pelvic exercises. A lot of these disorders are related to weakness of the muscles or the support of the pelvic area, so strengthening those muscles can really help. And that can either be done on your own, there are some home devices that can be used, or you can work one-on-one with a physical therapist. When a physical therapist is working with a patient, some patients can very easily isolate those muscles and learn to do the exercises easily, and other people need a little more guidance, and a biofeedback is a device that goes into the vagina that then you can see on a computer screen what your muscles are doing. So if the physical therapist tells you to relax, you can make sure you're actually relaxing those muscles by watching on the screen. And then when you need to squeeze them, you can see that response by looking at the screen.
There are also medical devices a doctor might use and prescribe to help.
A pessary is the most common one that we use that provides support. And then there are some other procedures depending on the type of disorder. There's medications that help with some of the incontinence, and then there are surgical procedures as well.
The first step is just being vocal about what you're experiencing.
Just coming and talking about it can be very helpful to see, is this something that there are a lot of conservative treatments that would be available? And to not be afraid or embarrassed to come and talk about it. This is stuff we see every day, and so it's easy to talk to us about it, I think. We have 2 urogynecologists and a urogynecologic nurse practitioner, and we're at www.gbmc.org/urogynecology.
For more information from GBMC, go to the website on your screen. We hope you enjoyed this prescription for a healthier you presented by GBMC Healthcare. To get more doses of GBMC RX, click the box under the circle and tap this circle to subscribe and learn more about becoming a healthier you.